All right. Hi, everyone. Thank you for joining us for the second presentation on healthcare and the things you wish they taught in school series. My name is Kaylee Bloom, and I will be moderating the presentation today for our speakers. They are Kathy Ernst, Jamie Savage, Dana Petmeyer, and then Susan Holt. And they are going to cover Medicaid 101 for us. So after the session or whenever you're prompted by them, feel free to ask any questions you have, and I will turn it over to them.
Thank you, Kaylee. We're going to start off. Jamie's going to give us kind of a Medicaid 101 presentation, and she's going to focus mainly on the family and children's programs.
All right, so Wyoming Medicaid is through the Wyoming Department of Health and the Division of Healthcare Financing. Our main office is here in Cheyenne. So Medicaid is a state and federal partnership that provides health coverage for selected categories of individuals based off of income and resources. Medicaid provides health care services to many different populations within three major groups. That's family and children, otherwise known as MAGI, the Medicare Savings Program, and the aged, blind, or disabled group. So in this 101, we'll focus on family and children's programs, which includes newborns, child MAGI, family MAGI, pregnant women, foster care, and kid care CHIP. So the first category is for children. There's different subcategories of that. There's newborn, child MAGI, foster care, and the kid care CHIP. Each of those is based on the eligibility of income of the mother and the father and the guardianships in the household other than foster care. But foster care is done through social services. Pregnant women is based off of income of 154% of federal poverty line. And then there's also family MAGI for the adults of the children. Typically with family MAGI, there has to be children under age 18 in the home. So eligibility for Medicaid begins on the first day of the month of the application when the person is found eligible. A person can also qualify for up to 3 months of retroactive coverage if they're found eligible at that initial application. Once they're found eligible, a child receives 12 continuous months of Medicaid coverage. So for kid care CHIP, it's a little different. Clients cannot have health insurance for 30 days prior to being eligible. Kid care CHIP is not available to state of Wyoming employees or employees with access to state of Wyoming benefit insurance. Retroactive coverage is also not available for the CHIP program. And when a client is eligible for CHIP, their coverage starts the month after the application. So as far as applying for Medicaid, there's different income that counts and does not count. The income that does count, the tax filer household income and the size of the household are used to determine that income eligibility for a program. The income of some household members may not be included if they are not related to or financially responsible for the child or pregnant woman in the household. A 5% of the federal poverty level disregard is given if the 5% would make a difference in the eligibility determination. So eligibility requirements is dependent upon income, the family size, tax filer status, and family relationships. And all of that information is provided at the time of the application. Basic eligibility requirements for all programs is Wyoming Residency, Citizenship, and Identity. So application requirements, Medicaid verifies eligibility factors. The application collects information on household members, income, and insurance. Electronic sources can verify some information on the application, but not all information. Families are required to submit verifications for any factors that cannot be verified electronically. Usually that's like pay stubs, bank accounts. For different programs, it can be vehicles and whatever resources like that. So citizen and identity, for verifications for that. If eligibility staff are unable to verify through our interfaces, the family will be required to provide verification like birth certificates, tribal IDs, or certificates of Indian blood. And to apply, there's several different ways. You can go to submit an application online at westsystem.wyo.gov, print the application off of the website, and mail or fax it in. You can mail or drop off complete applications if you're located in or near Cheyenne. You can email scanned applications, and you can fax applications to the 855-329-5205 number. When an application is submitted, eligibility is determined within 45 days. Written notices are sent and may include retroactive coverage for up to 90 days. And then once you're approved, the family will receive a Medicaid card in the mail. So for Wyoming Medicaid, you are eligible for 12 months, and then after that 12 months, a review is completed and eligibility is redetermined. This policy is intended to prevent eligible individuals from moving on and off the program and reduces administrative costs and improves the likelihood of individuals finding a medical home with continuity of care. And adults can be discontinued before the 12 continuous months if changes in income make them no longer eligible. And if you have any questions, this is my contact number. You can also contact Kathy as well.
Thanks, Jamie. So do you want to hold all questions till the end, or do you want to have questions per PowerPoint? How would you like to do that?
We can wait till the end.
Okay. All right. So I just want to bring up one thing when we're talking about eligibility and when you can lose eligibility. Currently, through the public health emergency, we're continuing benefits for all clients who had benefits on March 1st, 2020, until they notify us that the public health emergency is ended. We didn't want to put that in the PowerPoint because this will end, but I just wanted to bring that up just in case there's any confusion on that. And then I'm going to talk about our Medicare savings programs. Let me share my screen real quick. All right, can you see my screen? Yes. Okay, thanks. So our Medicare savings programs, they're programs for special, they're special programs for individuals who are receiving or entitled to Medicare and have limited income and resources. And the goal is to provide assistance with the cost of Medicare premiums, and for those who qualify, assist with Medicare cost sharing and deductibles, so the copays and deductibles. We have 3 different Medicare savings programs. They all have a different FPL level, federal poverty level, that makes you eligible. So our first one is the Qualified Medicare Beneficiary Program. We call it QMB, and it pays Medicare Part A and B premiums, co-insurance, and deductibles. And then we have our Specified Low Income Beneficiary, which we call SLMB, and Medicaid pays only for the Part A and B premiums. Most people have their Part B or Part A premium paid for, but there are some individuals who it's not covered. So in those cases, we can cover if they qualify. And then we have our qualified individuals, which we call QI, and Medicaid pays for the Medicare Part A and B premiums as well, The bottom two, it just comes out of different pots of money. The eligibility requirements for our Medicare savings programs, you have to be entitled to Medicare Part A and Part B. You have to be a Wyoming resident, a U.S. citizen or qualified immigrant. And then your income guidelines for the QMB, it's quite low. It's 100% of the FPL. And for SLMB, we go up to 120%, and for QI, up to 135% of the federal poverty level. And the resource guidelines is quite a bit higher than our other resource guidelines for our long-term care programs. For an individual, you can have 7,970 for an individual in resources, and for a married couple, 11,960. Resources, cash or other liquid assets or real property that a person owns that can be converted to cash. So things such as a checking and or savings account, properties such as land, your retirement and your pension plans. And then some resources are not counted, such as you can exclude one home if it's your primary place of residence, and vehicles with a motor are an exempt resource for these programs. And how to apply? The same way as our family and children's, you can apply online. You can print off the application and either drop it off or mail it in to 3001 East Pershing Boulevard, Suite 125, Cheyenne 82001. You can scan it to West Applications at wyo.gov, or you can fax them to 855-329-5205. So when do benefits begin? For QMB only, they begin on the first day of the month after eligibility is determined. So if you applied this month in March, the soonest you would be eligible would be April. For SLMB and QI, benefits begin on the first day of application, on the first day of the application month when determined eligible. So say you apply in March, you're determined eligible in March, they would start in March, unless you ask for retroactive, and retro is only available for the SLMB and QI up to 3 months prior to the month of application. So any retro months, you have to provide verification for all 3 months. And QMB, we're not able to pay for retroactive benefits for this program. A renewal must be completed every 12 months to determine continued eligibility. And cases can be closed if a client doesn't complete the renewal, moves out of state, enters a public institution, passes away, or determined no longer eligible. And then they're screened for other Medicaid programs before the case can be closed. We give at least 15 days closure notice unless the client passes away, moves out of state, or requests closure. There we have some reporting requirements for our Medicaid programs. So for our MSP programs, you must report income, resources, residency changes, and insurance changes. And that pretty much wraps it up for our Medicare savings programs. But this is a program that a lot of people don't realize we have, and so it's a good program for those clients that are Medicare eligible and just need a little extra help. And that's all I have on Medicare savings programs. So I will turn it over to our long-term care folks.
Hello, this is Dana Petmeyer, and I'm the Eligibility and Education Program Manager with the Department of Health. I've worked in Medicaid for 28 years now, and my focus is providing technical support and training on Medicaid eligibility. Today, we'd like to go through some of the programs that are offered in Wyoming. Go ahead and advance the slide, please. Jamie mentioned that we have over 50 different eligibility coverage groups within 3 categories: the family and children, Medicare savings, and the age, blind, or disabled. Within your packet, we sent a handout that shows several different programs that we cover and provides a little bit of detail on each of the programs. And Susan's going to display that so you can see the handout. Susan, we're seeing the fact sheet. Could you display the who is eligible in Wyoming handout, please? There we go. Okay, and make it a little bit larger for the audience. Okay, we like this handout because it describes the different programs that are offered in Wyoming. It gives you a little bit of information and what categories are covered. It's a good cheat sheet or handout if you have someone coming in and you want to determine whether or not they're eligible for a Medicaid program. And what we'll do is go back to the presentation, and at the end, if you have any questions on this information, we can address those at that time. Okay, the Department of Health Long-Term Care Unit, we process Medicaid applications and determine eligibility for the home and community-based service waivers. Within those waivers, we have the Community Choice Waiver, which we call CCW, the Acquired Brain Injury, which we call ABI, and then the Comprehensive Support and Children's Mental Health Waivers. We also handle applications for hospice, inpatient hospital care, and nursing home. If you apply for one of the programs that we handle within the long-term care unit, you can either mail the application to 122 West 25th. We're on the 4th floor west in Cheyenne, Wyoming. You can fax it to 307-777-8399. You can apply by phone by calling our 800 number, and that's 855-203-2936. Or you can scan and email the application to the long-term care unit at wyo.gov. Once we get an application, these applications are registered in our eligibility system, which we call WES. The administrative assistant in our office will distribute to an eligibility worker. That eligibility worker will screen the Medicaid application. They will contact the applicant or the representative to do a phone interview. Once a decision is made, they will determine what verifications are needed, and they'll send notification of what is required to determine eligibility. And then another notification is sent once a final decision is made to approve, deny, or if a case is ongoing and they have to close. There are some timeframes that are required by the federal regulations. The normal timeframe for an application is 45 days. 60 days if we're waiting for any type of verification from a third party, or 90 days when a disability determination is pending. Every applicant is required to meet Wyoming Residency. If you have someone who lives out of state and is looking at bringing their loved one or someone to Wyoming, we allow them to apply while they're out of state. They just are required to be in Wyoming within the 45-day application period. Now, if it takes them longer to get here, we will have to deny the application, but they have another 60 days from the denied application to come into Wyoming, and we can reestablish eligibility based on the same application. We are required to verify citizenship and identity. We have the revenue information system that we can actually verify for the applicant if they have a Wyoming driver's license or an ID card, and that verifies both citizenship and identity. If they're receiving Social Security or Medicare, we can verify that through the state online query, and that also verifies both citizenship and identity, and we're not required to obtain any other verification. An individual applying for the CCW or Community Choice Waiver, inpatient hospital care or nursing home, they're required to be age 65 or older, blind, or disabled. For the acquired brain injury, the age limit for that program is 21 through age 64. Clients may continue to be eligible after age 65 if they were eligible for their 65th birthday. So if someone is already ongoing and they turn age 65 under ABI, they can continue to meet the age requirement. We waive that criteria. Then we have the Children's Mental Health Waiver, and that's for individuals from age 4 through age 20. And then CCW, they're required to be age 19 or older to qualify. There is a 30-day requirement for someone applying for inpatient hospital care or nursing home. They are required to remain in the facility for 30 days or more. Hospice has a similar criteria. They have to complete 30 days of institutionalization prior to the hospice election, or complete a hospice election 30 days prior to authorization of benefits. What that means is that once they've met that 30-day requirement, we go back to the application month, and if they're found eligible, they become eligible beginning the first day of that month. In Wyoming, we are not date specific. If they're eligible one day of the month, they're eligible for the entire month. For the acquired brain injury, CCW, and nursing home, they're required to meet medical necessity on an LT 101. The LT 101 is completed by a public health nurse to determine if they meet the criteria to be under one of these programs. They also, if they're applying for a comprehensive support or children's mental health waiver, they also need to meet clinical eligibility. If someone's applying for hospice, they would have a life expectancy of 6 months or less to qualify for hospice. And that's certified through a physician, and they have to do a hospice election. And now Susan Holt is available. She's been doing the presentation for us to view it, and I'll let her introduce herself, and she's going to complete the rest of the presentation.
Susan, if you're speaking, you're on mute.
Thank you, Kathy. I didn't realize I clicked that button. So my name is Susan Holt, and I am the aged, blind, and disabled consultant for the long-term care unit. I've been with the unit for 3 years. I started out as an eligibility specialist, working cases and working with individuals in the community to assist clients with the Medicaid process. And now I have the benefit of working with our eligibility specialists when they have questions on applications or community to assist them with that application process as far as policies and procedures go. This next section goes over the income standards for the long-term care programs. The income standard for 2021 is $2,382. That is the 300% of the federal poverty level, and that is subject to change each year if there's a cost of living increase. And the department posts those income standards as of the 1st of January out on our website. So if anybody has any questions about what our income standard is, it's there, but we're also available to help with those figures. This applies to the home and community-based waiver program, the acquired brain injury, community choices waiver, children's mental health, comprehensive and support waivers, the income standard for hospice and inpatient hospital and nursing home. Occasionally, the income of an applicant might exceed the 2382. And for the nursing home program and the waiver programs, we can complete the standardized income trust packet in order for the client to meet the income guidelines. Only income of the applicant needs to be deposited into that income trust. And for waiver programs, a separate bank account must be opened in the name of the trust to be eligible for that program. And for the nursing home program, only if the applicant's income exceeds the Medicaid rate for the facility. Otherwise, for the nursing home program, we don't require that separate trust. If an income of an applicant exceeds the 300% FPL and they are wanting hospice or inpatient hospital, we cannot use an income trust to make them eligible or to establish eligibility. They would not be eligible for the program if their income exceeded those for those two programs. Verification of all income declared on the Medicaid application is required. We can use some of the interfaces, the state online query, the SOLQ interface for Social Security payments in most cases. Occasionally, if the income is off of a spouse or a parent, we may have to have that verified if we're not able to verify it. Other pensions or retirement plans, and we can accept an employer statement, a company statement, or an award letter from those organizations. And for earned income, an employer statement or wage stubs for the 30-day period, most recent from their application date. The resource standards for an applicant applying for any of the long-term care programs is $2,000 for an individual or $3,000 for the couple when both are applying. And if only one individual is applying in a marriage, there is a spousal allowance of $130,380 that's allowed, so that the spouse is able to keep resources for maintaining their home out in the community. Verification of all resources declared on the Medicaid application is required. The application is divided into sections, and Section D, our Appendix D, is the main section for the long-term care programs. And anything that the client would indicate yes that they have in that section, we would need a current statement showing what the balance at that institution is, or verification of that resource. We do have some other interfaces that are available for us, and one is our asset verification system. This is a request that is sent out to financial institutions, and it will verify any bank accounts 5 years prior to the Medicaid application. But we do still need bank statements. This just lets us know that there's an account at that institution. We have the revenue information system, so we can identify any vehicles registered to the client, or if there's a vehicle that has been sold and now registered with a new owner, we can verify that as well. And we can also use the county tax assessor's websites to determine if a client owns any property. And now we have all the fact sheets that were sent out. And I'll just bring those up real quick. So the first fact sheet is that community choices and home and community-based waiver. And then this just gives a brief overview of the financials for the community choices, in-home services, if they choose assisted living. It's just real brief so that a client can just see what is needed to apply for that program.
And Susan, it didn't display the fact sheet.
Okay, let me try again. Up there, did it show it now?
Yes, thank you.
Uh-huh. Okay, and so this just tells about whether or not, like, if they want to receive waiver services in their home. So there's in-home waiver services and assisted living waiver services. So they have their choice. And then it just gives real nice bullet points for a client to see if it's something that they might be interested in. And we do update these annually when those the cost of living increases go into effect. The next one is the fact sheet for the nursing home program. Again, just it's got the bullet points so clients can just read through real quickly to see if it's something that they're interested in, or that so that they would know what they would need to provide when applying for that program. And the last is the hospice fact sheet, so that they know what eligibility criteria and income is counted for hospice.
Okay, this is Kathy again, and I just wanted to bring up the fact that we get a lot of calls, mainly adults that just don't fit into a Medicaid coverage group. Unfortunately, it's not just income and assets. You have to meet a coverage group or you're not going to qualify. So other than the coverage groups we talked about, we do have a couple of other coverage groups I would like to bring to your attention. Let me share my screen here real quick. Are you able to see the breast and cervical cancer treatment program fact sheet?
Yes.
Yes.
Okay, thank you. So we do have a breast and cervical cancer treatment program. You have to go through the screening program to be eligible for this coverage group. So if you're screened through the Wyoming Breast and Cervical Cancer Early Detection Program, and if there is a positive biopsy, they can make a referral. So we do have that coverage group. We don't have any other specialized cancer treatment coverage groups or anything like that. But this is one group that we have. And it actually goes up to 250% of the federal poverty level. But like I said, you can't have any other insurance to be eligible for this program, and you have to be screened through that program. If you weren't screened through that program and you don't have health insurance, if you contact them immediately after your diagnosis, we still might be able to get you eligible, but otherwise they would still have to make that referral. So I wanted to share that one with you. And then we have what's called employed individuals with disabilities. And so what that is, you have to be deemed disabled by Social Security. If you haven't been, but you feel you're disabled and you have employment, the Department of Health can actually do a disability determination. But this is a coverage group for those who are disabled, but it gives them an opportunity to have insurance. And you have to be employed, you have to be deemed disabled. It's up ages 16 through the ages 65. And the income guidelines are the same as the other long-term care programs. So that's a couple other options that we do have for coverage, but adults without children, there's not a lot of coverage groups unless you are age blind or disabled. And also, even the family magi for the adults, the income limit is pretty low. So you have to make pretty low income to be eligible for that. So I just wanted to add that information. And unless any of the other eligibility experts have something to say, I think that kind of wraps up our presentation.
You want to open it for questions then?
I'm sorry, what was that?
Did you want to open up for questions now from the audience?
Does anyone have any questions for us?
I actually have a couple, primarily for the family and children, the Magi, and then I have one on for the Medicaid, age blind and disabled.
Okay.
So for family and children, what resources do you recommend to pregnant women, children, and or families who are not eligible but are still struggling?
So those that are not eligible,
I guess
for
Medicaid?
You're saying they're not eligible for Medicaid?
Yeah, they don't qualify. Like say they make too much, but they're still kind of struggling. Do you have any resources that you would recommend for that?
The best thing to do in situations like that would be to call 211 because they can help find local resources for the county of where that person resides.
Okay. And then is the hospice eligibility determination a faster process than the 45 to 90 days, just considering the lifespan and expectancy and everything?
The process of determining eligibility is the same. They have to submit verification of income and resources. So if that information is submitted with the application, along with the hospice election and physician statement, it may not take up to 45 days. But we are still required to verify both income, resources, and obtain those forms before we can determine eligibility.
Okay, that makes sense for me. So thank you. Those were the only two questions I have. And I'm not sure if we have any others, but I'll go ahead and wait and see. All right, so I think that's all the questions we're going to have for tonight. Is there anything, any last comments or anything that you all have on these topics, or any reminders or anything else you can think of?
I can't really think of anything. We're always here to answer questions if people have them, though. And both of the presentations, between the two presentations, I think you have all of our information.
Yes, and anyone that would like the PowerPoints, please email the reference account if you did not already get those. That will be reference@natronacountylibrary.org, and we can send those over to you, no problem. But I would just like to thank Kathy, Dana, Jamie, and Susan for all coming to this tonight and giving this presentation. And I would just like to remind anyone watching this that next week's was canceled and we are in the middle of rescheduling that. So there will not be another presentation on healthcare this month, but next month we'll be starting up. All right.
All right. Well, thank you for inviting us.
Of course. Thank you so much for your time tonight. This was wonderful.
Thank you.
Bye-bye.
Thank you. Bye-bye.